and then we'll finish it off with Kevin Dick, the district health officer. Aaron, if you're ready, please start us off. Aaron, it looks like you're on mute.
Oh, well, that was, I was just trying to see if everybody knew how to read lips.
Well done.
This is Aaron Keniston, Washoe County Emergency Manager. I just wanted to kick it off by saying thank you. You know, we're 100+ days into this incident, and we're a region known for having emergencies that are a very short duration and geographically contained, if you will, if you think back to the flooding and some of the other issues that we've had. 100 days is a long time to keep people's attention. So we are so very reliant and appreciative of our media partners to help us. You know, the public, I think, is weary, and yet, you know, we have to keep messaging because the key to our success is the social distancing, the wearing of masks, the things that health authorities tell us are so very important. So I'll just finish by saying, you know, I think it's going to come down to kind of like it does in many incidents, neighbor helping neighbor, reminding each other, doing our best to contain the virus. So thanks for your role in that. And that's it for me. Thanks.
All right. Any questions for the incident commander? All right. Hearing none, we will pass it over to Dr. Krista McNeil, the Washoe County School District. Take it away, Dr. McNeil.
Good morning, everyone. Can everyone hear me?
Yep, we can hear you just fine.
All right. Perfect. Well, thank you for allowing me to speak with you all today. We've been so blessed to have our media partners help us get the good work of what's happening within the school district out. We are putting together, we have our reopening task force that has over 60 members from the public, parents, community members, teachers, principals on our reopening task force. And they're doing some tremendous work. They meet approximately twice a week. We also have our COVID task force that I just was in a meeting and then I have to pop back into that meeting. We have our Board of Trustees meeting coming up on Tuesday. And so we'll be bringing some preliminary decision points to our board around what the reopening plans would look like. Then we've added a board meeting for July 7th. And so then the board will see another phase of our reopening plans. We've got surveys out in the field, as you all know. We finished our distance learning survey, and so those results will be coming to the July 7th board meeting. But right now in the field, we have an extremely important survey around reopening. And so we're asking some really important questions of our community, our parents, our students, and our staff to give us their input on what they would like to see on reopening. I'm sure that you all can imagine the enormous complexity that this has for a school district, what social distancing, personal protective equipment, what that looks like, transportation, what the social distancing looks like on a bus, what it looks like on the playground, what it looks like in a classroom. So we're putting these plans together, and we're looking forward to having the community provide their input on that. We do have, like I said, our reopening task force. We post all of those minutes. The public can go to www.washoeschools.net /reopening and see all of the work that we're doing for that. We also, as you all helped us get the word out, that we were opening up our district fields and our facilities for staff and students to practice, beginning with fall sports on July 6th. All of our coaches will be attending a mandatory training to learn more about the safety measures that they must have in place to make sure that our student athletes are safe, that our coaches are safe. The use of fields, weight rooms, and gyms. This is only for those types of facility, no locker rooms at this time. The regular cleaning of all of our sports equipment. And then obviously, thank you to our media partners for getting the word out around kindergarten registration. Our schools are open for making appointments for kindergarten registration. Our school secretaries are working very hard to make sure that our families have all the information that they need. And we also have information on our website for that, washoschools.net. And then finally, just reminding our community and our students especially that we do have Safe Voices up and running for any types of reports that our students need to make and our families need to make. That is http /safevoicenevada.org /. And then just to remind our families that free meals are available at more than 20 sites in Washoe County, including a number of our schools. We've had tremendous support from Northern Nevada Food Bank, and then just keep continuing to check our website for that. And then summer learning, our summer learning program begins next week. We'll be posting materials online and distributing hard copy packets for our elementary schools. And then we'll also be coming out with a media release around our summer programming. So with that, I'll open it up to any questions.
Thank you, Dr. McNeil. Please, if you have a question, say it now or leave it in the comments and I can get to it. Thank you.
Hey, Kristen, it's Siobhan from the RGJ. And I know this is an impossible question to ask, and we've talked about this before, but will students, do you think, based on everything you know right now and the way things stand right now, could all the kids just be back in school in August, like, you know, in classes full time? Or do you think it's going to, you know, end up being a combination or a part-time thing? Do you think there's any chance that school goes back to looking a little, I mean, with safety measures, of course, looking a little bit like school has in the past? Or do you think it's all going to be a combination, or, you know, what's your best guess right now?
Yeah, and that's the crystal ball, right? That's the $1 million question, Siobhan. And I think as we progress through the phases, you know, a lot of these decisions are going to be based around the directives. And so that's why it's difficult. We are making plans that have to model what you're talking about is, you know, absolute brick and mortar. We have to model a plan that has virtual distance learning opportunities available for our families and what that's going to take a look like. And then making sure that safety for our employees and our students are you know, the number one priority. Can I sit here today on June 17th and tell what schools are going to look like? I can't, but we have to make plans to make sure that we are going to be doing everything we can to ensure the safety of our students and our staff.
I think I saw a hand raised. Mike Stephenson from COLO.
Hey, Dr. McNeil, in regards to the athletic facilities, was that July 6th date, was that something you already were envisioning, or did you guys have to come up with that after the governor gave the go-ahead last week? And I just wonder what you envision the return to sports looking like.
Yeah, and we actually met as a superintendent group with all the superintendents across the state when those directives came out, because we wanted to make sure that obviously that we're working in alignment with the governor's directives, but also importantly alongside the NIAA to make sure that we understood what those directives were as superintendents. And so the priority right now is to make sure that our coaches have that training and that fall sports is the priority. And then we're going to see how that goes. And then open up accordingly for you know, other sports and what that looks like to our facilities. But we wanted to make the priority fall sports and the practice and make sure our coaches had all of the information that they needed so that they felt comfortable submitting their plans, because each one of our coaches has to submit a plan which has to be approved, that they are putting those directives into place to make sure our athletes are safe.
All right, looks like Shah Ahmad, you got a question?
Yes. The beginning of the school year kind of coincides with flu season, which will obviously be complicated by COVID. Is that part of the consideration as well? I mean, are you guys preparing for another possible wave of COVID, specifically with consideration for families that may not have access to digital learning?
So we work very closely with the Washoe County Health District. They have a representative on our reopening task force, and that's been a concern, you know, I think on a national level, if there's going to be another wave. And so we will take every precaution that's necessary, and we will be following Washoe County Health District guidelines around that.
All right, any more questions for Dr. McNeil?
Hello, hi, this is Bert Johnson with Cap Radio News. Can y'all hear me?
Mm-hmm.
Great, thank you so much for taking the time, taking my question. I really wanted to ask about youth sports because I've seen some teams, you know, attending practices around town. And from what I've seen, social distancing is not really happening. So I'm curious what steps the school district is going to take to make sure that those sports return in a safe way.
Yeah, that's a great question. And that's the reason why. Oh, there's some feedback there. That's the reason why that those plans are so important, and that the training of our coaches is so necessary, because they're going to have to follow those protocols. And if they don't follow those protocols, then you know, we'll have to take action to either make sure that, you know, that those steps are corrected, or they won't be allowed to practice. But the safety of our athletes and our staff is an extreme priority, and that's the reason why we're taking this slow, and the reason why it takes that amount of time, you know, and why we didn't open up right away, because we wanted to make sure that we had established plans in place, that the plans were approved, and their coaches had the training for that and what that looks like.
All right, one last call. Any more questions for Dr. McNeil? All right, hearing none. Thank you so much, Dr. McNeil, for being with us.
Thank you.
I'll now turn it over to Kevin Dick, the District Health Officer, for a brief update and questions afterward. Go ahead, Kevin.
Thank you, Scott. And I wanted to also thank Dr. McNeil and your team. The school district is really working very hard, a huge effort being made to try to figure out what the best solutions are to keep our students safe, to be able to provide them with a good education, and to keep our community safe as we move forward. I have some updated statistics for our COVID case counts. We have 7 additional cases that we're reporting today. That brings our total case count in Washoe County to 2,023. We have, sadly, we reported an additional death yesterday. So our deaths are at 71 total from COVID-19 in Washoe County. We have over 1,300 cases that have recovered, 1,318. We have 634 active cases. So our active cases remain quite high. Was just about a week ago, we were closer to 550 active cases. Currently, we have 68 individuals that are hospitalized. We've had 169 people that have been released from the hospital. The hospitals remain with good capacity. 75% of our short-term acute care hospital beds occupied. 47% of our ICU units occupied, and only 19% of ventilators in use. The testing continues. We're operating our post today. Expect to test about 350 individuals through the drive-through testing today. As of yesterday, there were 41,875 test results that had been reported from samples collected in Washoe County. I want to speak to the record number of COVID-19 cases that were reported statewide earlier this week at 379. Washoe County's one-day record was just on the 11th of June, last Thursday, when we reported 61 additional cases. So we are seeing high numbers of cases. I want to caution people from looking at the results just over the last couple of days, with 16 new cases yesterday and 7 new cases today, that the state lab is being impacted by the high number of tests coming in for them to run, particularly with the state testing all of the inmates at the correctional facilities. So we still have not received lab results back from testing that we conducted last Friday. And just from the testing that was done by the county, both here at the post and at Incline Village, we had over 750 individuals tested. So we may be seeing some delays with some of the numbers that are being reported. But our 7-day rolling average remains up at a peak level. So we have quite a lot of COVID activity happening here. So I think everybody is aware of the governor's address a few days ago, where he announced the holdback on going to a phase 3 reopening based on what we've been seeing. And yesterday, Commissioner Marilyn Kirkpatrick made statements about the need for everyone to be wearing masks, and that she was not going to proceed with reopening until people were really taking this seriously. So I think that Aaron Keniston's remarks at the beginning were spot on. We were 100 days into this, and people are becoming weary. People want to get back to normal. But we are not in a place where we can do that right now. And the timeline is not set by people's weariness or that desire for normal. The timeline is set by COVID-19, as the governor stated. And so I just wanted to emphasize the importance of everybody continuing to work together to be the solution. The solution to this is people wearing masks when they're out and interacting with others, maintaining that social distancing, taking all of those precautions. And I'm aware that that isn't occurring in some circumstances. Business owners need to be responsible within their facilities. The governor's directives require employees to wear masks. And that's not occurring in some situations. They need to ensure that is occurring. I would also encourage business owners to require their customers to wear masks. While it's not being required by the government, those businesses do have control over the people that they're serving as their customers. So I would suggest no shirt, no shoes, no mask, no service, if we really want to be serious. There have been a few different studies that have come out recently through the National Academy of Sciences and the Lancet that show the importance of masks for helping to reduce the spread of COVID-19. To be successful, that's what we need to do, wear masks to keep our economy going. So with that, I'll open it up for questions.
Hi, this is Siobhan from the RGJ. Any information on the antibodies testing, the study you're doing with UNR and where those results stand right now?
Yeah, we just received results back from the antibody testing, and the researchers at UNR are working with our EPI team to analyze that data. There is additional work that needs to be done where they will be looking at what the demographics were for each of the census tract areas that were selected for the households randomly to participate in the testing. They'll need to be doing weighting based on those demographics and also by the number of households that participated from each of those tracts to crunch the numbers to come up with a reliable number for us of what the spread of COVID-19 has been in our community.
Have you finished all of that antibodies testing now?
The testing has all been run, correct.
Okay. And then you said you're looking at data. Anything that when you look at it that it sticks out in your mind that you can share? Anything, any preliminary hypothesis about what it looks like?
I'd wait to get the results back from the researchers once they crunch the numbers. But I think initially what I could say is it doesn't appear that we have something like 15% spread like has been found in some of the studies back in New York City, for instance.
Right. And just with your knowledge, having been in this now for 100 days, do you think that we haven't really hit it? It just hasn't even really hit here yet then, based on some of that, and that we're not at that 15%, or there's no chance we're at a, herd immunity level at all? Do you think it's just, this swept through the area in very small, significant way so far?
Yeah, I guess I can confidently say we're nowhere near herd immunity. And I think what we're going to see when we do have these results, and again, I want to make sure that this is all done scientifically, so that we've got something reliable that we're releasing. But I think what we'll see is the efficacy of the governor's actions to close non-essential businesses, the stay-at-home orders, the hard work and sacrifices that everybody in our community has made to try to prevent the spread. I think that'll be borne out when we see what the level of people that have been exposed is.
Looks like we got some hands raised in the comment section. You don't have to raise your hand in the comment section. It's okay. But go ahead, Shah from KRNV.
Hey, just a quick question. I know that the vaccine is still months away. From what you understand about the disease, is this something that will require an annual vaccine, or is this, once people have enough antibodies that they have enough to fight off the disease for good, or if this is a one vaccine and you're good? What are we understanding about, how much this will linger into the future?
I think that's a difficult question to answer right now, because we just don't know enough about how the vaccines are going to perform, and probably don't even know enough about the disease and how it may change over time. So just purely speculating, I would suspect that this is probably not going to be a one and done type vaccine, but that people would need to have some sort of a regular booster or new vaccine for this. But again, that's speculation.
So would you consider that kind of like you would be getting a flu shot, you would be getting a shot like this?
I think that may well likely be the future scenario.
Paul Nelson, looks like you have your hand raised.
Yeah, when it comes to the contact tracing, what have you guys learned with the spike that we saw last week, that single day spike, and statewide too? With the contact tracing, is it something from phase 2? We're a few weeks away from Memorial Day now, and some other things, the protests that happened. Are we seeing any of those things have caused this spike?
So I think what I can tell you is that what we're continuing to see are cases that are coming from gatherings, people bringing folks together from outside of their household, or being in one of those gatherings, and where we see the transmission then occurring. And so I know some of those were associated with the Memorial Day celebrations that were occurring. As far as the protests, so far, our data doesn't indicate that we've seen a big spike from the protests, but the state has also been working to contact individuals to assess whether they were involved in protest activities, whether they had visited casinos, et cetera. So I expect that we'll have some better information coming out from the state on what they're seeing with their surveying our cases as well as cases throughout the state.
So nothing yet, no information yet on the, as we get farther into phase 2, if that's having any kind of effect yet?
I think we probably are seeing some effects just of people being reopened and out and about, but I don't think we can quantify what that is, just breaking that off separately from everything else that's going on.
Bert Johnson, you got a question?
Yes, thank you. And again, thanks for taking the time. I've seen a lot of reports about casino customers declining to wear masks, declining to follow social distancing protocols, etc. Meanwhile, the employees themselves are required to wear masks. Do you think there's going to be a point at which the health district mandates that people who are customers in casinos wear masks while they're inside the properties?
I don't think that we're at that point. I mean, we're encouraging the property owners to require customers to wear masks. They clearly have the authority to do that. The Gaming Control Board doesn't need to require them to do that. They can do that on their own. I would encourage people that are reluctant to wear a mask to recognize the importance of that mask, to continue to be able to have places like casinos open, so that we don't have a big spike in cases that requires us to move backwards. I think we should be solution oriented. I think that the masks are a solution. I think that the state occupational health agency could also play a role in what we do with these workplaces.
And a quick follow-up, if I may. Under Governor Sisolak's reopening plan, county level officials are authorized to implement stricter measures than the state itself does. So do you think that if those trends continue where people aren't following these guidelines, is that something Washoe County is willing to consider, mandating that customers in casinos wear masks?
We're not at that point yet. It's a possibility that we could make that decision in the future.
All right, any more questions for Kevin Dick?
Yes, hi. This is Laura with the Reno Al Dia Digital Newscast in Spanish. There's a message that is on the social sites saying that a doctor posted, well, I don't know what kind of doctor because he doesn't say a name or anything. And basically what he's saying, and a lot of Hispanics have asked me about it, and it says that the doctor is saying that everybody who goes outside and breathes for at least 2 minutes, it's already, the COVID is already in their system, and that everybody has it. And the only people who, well, some of them develop the illness and get really, really sick, and some others don't. So how can we explain people that this is not that you breathe it or you breathe air and you already have it?
Well, I don't think that that's a reliable source of information. That's, you know, what we want for people to do is to maintain that social distancing. We know that that COVID-19 is spread by droplets and aerosols that come out when we're speaking, when we're coughing, singing, just walking around and breathing. And so it's that proximity to people that have COVID-19 and that airborne spread of droplets and aerosols that is how people contract the disease. And so it's not a matter of just going outside and now you've been exposed. It's that spread from individuals, which is why we're emphasizing the social distancing and the wearing of masks. This is something that people can influence their outcomes and outcomes of others. And so people need to be empowered with this knowledge of how the disease works and spreads and what they can do to stop it. And that's why we continue to emphasize that message of what you can do is wear a mask, socially distance, wash your hands, all the things that everybody knows.
Okay, thank you. And are we continuing with the asymptomatic testing, or until when?
Right now, because of the backlog that the state lab has with their testing, they have asked us not to be testing asymptomatic individuals through our post right now. So at this point, we've reduced the testing to our priority populations and symptomatic individuals for the testing this week. And so we hope we can open that back up more broadly in the near future.
Do we have any results of the last testing? There were a lot of positive cases.
Are you referring to the week that we had
Yes.
the big event where we were really pushing for people to come for the testing? That was the week of June 1st. And we tested 2,071 individuals through the post that week. I can't give you the number broken out by just the people that came through the post versus all of the other test results that came in through people tested in Washoe County. But I can tell you that week of June 1st, we had 216 positives that we reported.
Okay, thank you. I'm good.
This is Paul Nelson again. Is there any kind of data that indicates that the higher number of testing, if that's causing the spike that we saw last week? And had the two-part question I had. I forgot the second one, but can you answer that first one at least? If the higher amount of testing is causing the spike?
Yeah, the higher amount of testing is not what's causing the spike. If you go onto the state's dashboard, they now have a 7-day rolling average of the positivity of the test results that they're reporting. And so you can see that while testing has increased, what we've seen over the last week has been an increase in the number of those tests that are positive. So that's an indication that we have more community spread of the disease that's occurring.
And then the other one was the backlog. Do we know how long before that backlog gets back and the lab is testing their regular number again?
I'm afraid I don't, because we don't really have good information on who all is submitting the tests to the state lab, how many, and at what time. And I think we need to be working on that, and I've asked the state to see if they can help with managing that lab capacity so everybody gets results back in a timely manner.
Any other questions?
Oh, I'm sorry.
Okay.
Yeah.
I'll go ahead. Thank you. So this is Stephanie Serrano with KUNR Public Radio. I just have a quick question about contact tracing. What individuals are actually getting involved with which patient or which cases? Are asymptomatic people also getting contact tracing?
So if I'm understanding your question correctly, it's of the positive cases that we get back from the lab that they're positive for COVID-19, are we doing contact tracing with asymptomatic individuals?
Yes.
Yes, we are.
So what? I think I'm hearing people saying that they're not getting asked questions that who are asymptomatic.
That they're
So
not.
I think that's just right. I think there's a worry in the community that people aren't actually being told when somebody close to them has a positive case.
I believe that that's not correct information. We are following up with the asymptomatic individuals and who their contacts are.
Okay. Thank you.
One last question, Kevin. This is Laura again with Reno Al Dia Digital Spanish Newscast. Do we know how many Hispanics did you test at Incline Village?
The number of the people at Incline Village that were Hispanic, I don't have that number.
Can you find out for me?
I don't know if we can, but I'll ask Scott if he can help track that down.
Okay, thank you.
Oh, I have to stop you there. I think somebody's asking a question, but I can't hear exactly what's being said.
You hear me now?
There you go.
Okay, great. So real quickly, what's really the danger level where we might have to reverse course and go back a phase? Like, what is Washoe County's threshold here in terms of rise of cases where we have to kind of change course?
We haven't drawn a bright line and said, hey, this is it, and we're going to change course. I think what we're doing is monitoring where we're at and where we're going. We need to get some of the test results back from the state lab. I think to really know where we're at right now. We've had just the lower number of cases the last few days, but with the high number that we had on Thursday, we're still really at a peak level with that 7-day rolling average.
So I guess where for the public to kind of contextualize. Can you hear me again?
That's better.
Okay, for the public to kind of contextualize the level or the threat of this disease, I mean, what should they be looking out for in terms of hospitalizations? Because I know there's a lot of numbers being tossed out, and some can be alarming, some can be, very relaxing. So what really should the public look at in terms of this is where my community is at right now?
Well, I think what we're looking at is trends. And what we had seen was a trend of increasing hospitalizations that had occurred. But we also need to recognize that hospitalizations lag behind the new case identification. So with 61 new cases that were identified last Thursday, it could be 2 weeks to a month by the time we really see those cases having the severity of illness where they're now going to the hospital.
Any more questions for Kevin Dick? All right. Thank you guys for joining us. If you have any other follow-up questions, feel free to reach out to me. Laura, I'll work with you on your question regarding the testing out in Incline Village.
Thank you very much.
Okay. Have a great day, guys. Thank you for joining us.